So antihistamines are exactly what they say. They are taking histamine out of the body. What you may not know is that a part of this whole histamine challenge is from the liver also. So there's actually a product that we use in our practice called Antronix, which is a natural antihistamine. And so what we have found a lot of times is you have a allergy problem because your liver's plugged up. So that's why we encourage the castor oil pack. So what I'm trying you to get from this particular half hour of health is how important digestion is for your allergies. Because it's not taking another allergy pill. I'm going to give you responsibility of things that you need to change. Okay, so antihistamines take the histamine out of your body, but histamine is a natural reaction to those undigested protein particles. So I want you to think about this. If you are constantly eating these proteins and your body's going through these emotional highs and lows, you might not realize it, but doesn't some of you, when you eat a particular food, just kind of makes you feel good? Don't you just like seek certain like comfort foods? Well, what's happening is that those comfort foods are causing a subliminal reaction inside of your body. Toxins. Toxins affect you because of pollution, and the foods you eat have to be processed by your body. Recently, it was reported in all the major newspapers news that we have a lot of toxins in our water. We have estrogens in our water, we have antidepressants in our water, we know we have a lot of chemicals inside of our water. And I don't want to be a doom and gloomer, but this is very serious. You have to make sure that your liver is functioning optimally to handle all of these toxins. And I would not drink tap water. I would only drink purified water because tap water itself can put a lot of toxins inside of your body. From my experience, I do not believe that pollen is the reason that people get hay fever. Now you can say, why is that? Because pollen's around all of us. So if pollen was the cause, guess what? We'd all have hay fever. We'd all have allergies. And the most amazing one to me is during the springtime, you know, when I believe it's a poplar tree, has those little white fuzzies, and you see just gazillions of them. I had one gentleman that told me, he goes, you know, when those little white fuzzies come out, my allergies are worse. And I wanted to say to him, I've never breathed one of them in my nose. I mean, I can see pollen on top of your car. So we'll say, Dr. Bob, why does it happen during the springtime? I am sure that there's some type of protein reaction that's occurring in the person's body. If you get your upper cervical adjusted, which we'll talk about, and your mid-back, but it comes back to, do you have digestive distress? Do you have digestive distress after you eat? Do you pass gas? Do you burp a lot? That's a sign to me that you could have an allergy issue. Not that that is causing your allergies itself. It's a sign. It's a sign of poor digestion. Food combining can do it also. I have a lot of people that come to see me and they ask me questions about allergy shots. Do allergy shots help? No. Allergy shots will only desensitize you to one item. And after your body gets used to that, guess what happens? There's another item. I mean, I've had people say that they've been allergic to all kinds of stuff. You want to have proper protein metabolism in your body. Let me just give you another little nugget. Do you know that your pancreas could also be involved with allergies? What does that mean, Dr. Bob? Your pancreas makes enzymes. See, everybody thinks that your pancreas makes insulin. It does. But it also makes enzymes like lipase and amylase and protease. If you eat a lot of junk food, if you eat a lot of processed food, you're going to run out of enzymes. So some of you may have an allergy because your pancreas is stressed out because you're eating not enough whole food. Stop eating processed food. And as a side note, you don't want to eat canned food. Canned food, you know, they put a plastic liner inside of the can, and when they heat that can up at high temperatures, it releases chemical toxins. So I want you just to be aware of that. Sinus surgery. Think about this. They get a drill about this long. They go to the Home Depot. They don't really. But they get a drill. Now watch. They put that drill, and they do a local anesthesia usually, and they drill right up into your nose. And then they go and they do it on the other side. I had one patient that had it done 8 times. Now think about what I'm going to share with you. Think about this. Inside of your skull here, there are sinuses. Sinuses help warm air as it goes through your body. There's little holes that go where these sutures are at. Those holes can get plugged up with fluid. That's why you get this achy pain here. You're doing this to yourself because you want it to drain. It's inflamed. So when they drill, they're making the hole big for a season, but guess what's going to happen to it? it's going to get small again. So it comes down to inflammation. That's why I talk about inflammation in Dr. Bob's Drugless Guide to Balancing Female Hormones. And that's why I talk about it in Dr. Bob's Trans Fat Survival Guide. Some of you can have allergies because you're eating trans fat. It comes down to digestive distress. I had one gentleman that came into our office. He had sinus surgery 22 years ago. 22 years ago. He had sinus pain after that. Came into our office, and after his very first adjustment, guess what happened to his sinus pain? It went away. The sinus surgery they did to him was not successful. So you can get in a car accident. Let me go down to subluxation. Let's move ahead a little bit. I'm going to turn around here. I'm going to point to my neck. Right here. The second cervical vertebra right here, that is the vertebra that's directly associated with your sinuses. Now, do you notice that when you come into my office, that on a good percentage of you, that I'll have you lay in my hand and I adjust what we call L1. I adjust this area here, and I always see this big old grin on your face. Then I move up a little bit higher and I adjust T6. Then I have you flip over to your sugar spot and I hit T4 on the left. Then I roll you over and I hit the second cervical on this side. Every one of those adjustments, you know what they're designed to do? Stop your allergies. Why is that? L1, that's right here, is for your colon. Not to be silly, but you want to have a good bowel movement every day. If you don't have a good bowel movement every day, your body's absorbing toxins. So when I go up to T6, and I had that written down there, T6. T6 is for your stomach. You want to have proper stomach digestion. If you don't have proper stomach digestion, you're going to have chronic allergies. And C2, do you know when you lay down on your back and I put my hands on your upper neck and I do that adjustment and I can just see that big old smile on your face and I have people come up, how many of you, when I've given you an adjustment, have gotten off the table and your sinuses are clear, like immediately? Does any of that happen to any of you, like you just get up? It happens, doesn't it? I had this one young girl that got up off the table. She was about 8 years old, and she looked at me with this big grin, and you know what she said? That was faster than Benadryl. She did. So you could just, so you know, these young children that come in with ear infections, you know, I have medical doctors that are patients of ours, and we don't call them Dr. So-and-so when they come, they're kind of incognito. And what's really is amazing is that I had one particular lady that was in, and her son has been sick with bronchitis for a week, and she took her son to their pediatrician, and the pediatrician gave her a prescription. She came in the office, and she said this child had not been adjusted yet. And she kind of looked at me with these sad eyes like they were going on vacation, and she just didn't know what to do. So I gave the little boy, we scanned him, I gave the boy an adjustment, and guess what? She called me the next day. You'd have thought that I was her very, very, very best friend because it all went away. You notice when all these kids come in, the parents that really understand what we do, those kids don't get sick. I had a mom right now who's having baby number 2. You know why she's so excited? Baby number 1, nothing wrong. It's amazing how many people bring their children in within 6 to 10 days after they're born. So let's move up to treatment, more acid. Now, I don't want to confuse anybody about more acid and alkaline. When people are alkaline, they have a greater chance to have sinus challenges. You won't die of cancer, because people who have cancer are usually acid. If you consume a lot of citrus, when we do your saliva pH, when you're usually about week 15 on your initial examination, we have pH paper on our webpage. If your pH paper is purple, you're alkaline. People who are alkaline have a greater chance to have allergy issues. People who are alkaline have a greater chance to be alkaline or have allergy issues. If you have chronic allergies, you always want to take a digestive aid. You don't want to drink fluids with your meals. You don't want to drink cold water ever with your meals. So we talked about subluxation. Subluxation is when we have that second cervical or T6 or L1 be affected in your body. Some of the items that we use in our practice, we use a product called Cataplex ACP. Well, let me tell you this. I would like you all to eat about 4 or 5 baby carrots every day. Great source of vitamin A. I'd like all of you to eat some red peppers, yellow peppers, or orange peppers. Not the whole pepper, but some of that every day. Great source of vitamin C. I mentioned to you that product we use called Antranex. Antranex is a natural antihistamine. You say, Dr. Bob, I thought you didn't want to use the antihistamine. Antranex helps your liver process all of the toxins. Thymex is a nucleoprotein. It's thymus tissue from a cow. Congoplex is a product that we use for patients that have colds. It has some thymus tissue in it. A lot of times people need a little bit more calcium. One of my favorite products is Agricept. Agricept is